So we're now going to release the hips, and it looks like I may be getting some help from my dog Feta. So what often happens with the hips when they get out of line or out of balance is that the back of the hip joint, so right underneath the butt, can get a bit tight, and the hip is a ball and socket joint. Can I have that hand up, please? So if the hip is a ball and socket joint, if it's tight at the back, it pushes the head of femur forwards in the socket. It's not going to push it like out of line. It's not going to be, you know, sort of dislocated or anything like that. But there's too much force on the back of it, and that just gives it a slight forward force, if you like. And what that does is it then makes it tender at the front because it's being pushed into the front of the capsule, and the capsule is a very sensitive piece of kit. So what we're going to do is release off the back of the capsule first, and then we're going to retrain the muscles that pull the hip backwards in the socket. Okay, so first things first, if you just reach straight under your butt, take the tennis ball, pop it under your butt, there we go. And you're just going to find the spots, again, wiggle around, find the spot that's tightest or most tender, and you're just going to hold the ball there. Now for me, I find that I get the most pressure on that if I just let the knee roll out to the side a little bit. So if I let the knee roll out to the side, put a bit more pressure on it. Now I'm only going to sort of 2 or 3 out of 10, where 10's the worst pain you can imagine and 0 is no pain at all. So maximum of 2 or 3, because I can relax and breathe into that discomfort. Whereas anything higher than that, and my body starts to go and just sort of, you know, fight or flight and pushes the ball out, whereas I want to be able to relax. So I'm just going to breathe into that. I found that spot under there, so I'm breathing in and out, and on the out breath I'm going to try and get the muscle to relax as much as I possibly can. So 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and I can feel that starting to really let go. So I'm going to come out of there now. I'm going to find another spot. I'm going to wiggle up and down a bit. There's another spot just behind the hip there. So again, I'm just going to need to come slightly onto my side for that one. So let's breathe into that. So 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and relax, and then find one more spot if you can. So I'm going to go a bit further across towards my sacrum, the little bone in the back of the pelvis, and I'm going to breathe into that for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and release. Okay, so now I'm going to take the ball under my right butt cheek. If Feta will let me, she's just decided to lie down by my right side. Okay, so ball under butt. Here we go. Oh yeah, that's the spot. So again, I need to let my knee just roll out for that one so I can get nice deep into that spot. Again, just breathing on an out breath, really try and let go. So let's go for the 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And let's move that ball. So I'm just going to wiggle around a bit, find another spot. There we go. Okay, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and release. And then I'm going to find one more spot again, a little bit further across, around the back. There we go. And again, so the point of this is not that we're, you know, somehow doing some magical change to the muscle. The point is that the ball is there just to give your brain feedback and to tell your brain where to relax. So it's just it's like having a pokey finger in there, except you're not going to hurt your finger. So it's just the ball is there just to go, hey brain, this is the point where you want to let go and relax, because being tight at the back here is not serving you. So it's just a bit of a reminder, if you like, for your brain. So again, here we go. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and let go there, bring the ball out, and then we can start looking at going to stabilise. So to start off with the stabilising process, the muscles that stabilise the back of the hip and pull the ball back into the socket are the back fibres of gluteus medius. So what we're going to try and do is visualise and feel the hips being drawn backwards into the sockets. So what I want you to start with is if you put your hands underneath your butt, just fingertips underneath your butt so that you can feel what's going on there, gives your brain a bit more feedback. This is all about learning for the brain, neuroplasticity. And then what we're going to do is try and squeeze your butt cheeks together. But we're going to try and squeeze them together by pulling your legs backwards. So it's pulling the hips backwards in the sockets. So I just want you to see if you can do that. And as you can see, when my glutes squeeze, I rise up and down, rise up when they squeeze, and I plop back down when they relax. So rise up when they squeeze and plop back down when they relax. So that's what the effect that you should have. If you find that you do not have that, try sort of digging your toes into the floor and almost dragging them backwards, using the floor as a resistance. So pull your toes backwards, and I find that that helps to trigger my glutes to fire. So once you've got the hang of doing both at once, that's really nice, but as I said, the reason we use these glutes is to control the ball within the socket as you walk. Now, we don't walk sitting down, and we don't walk with both legs at once. So we need to be able to switch on alternate glutes. So I'm going to start off by just seeing if you can switch on the right one without the left. And if you need to pull backwards with that foot, that's completely fine. So switch on the right glute and relax. Right glute and relax. Right glute and relax. And I'm really trying to pull that all backwards. So I'm visualising that muscle coming back. And then going the left one, switch on and relax. Switch on and relax. Switch on and relax. Now I'm just going to turn my back to you in case that looks in case it gets a bit clearer like that. So I've got my fingertips under the butt like this, and then I'm switching on the right one, and then the left one, and the right one, and the left one. And so I'm just getting that rhythm going, like I would if I was walking. Now I'm exaggerating, I'm not expecting this much muscle firing to be happening when you're walking, but I do want this to be the muscle that you use to stabilise the back of your hips with. So that is how you do it sitting down. But as I said, it's not enough to do it when you're sitting down, we need to do it standing. So that's what I'm going to do next. So what I'm going to do now is to get the glutes firing while standing, and again it's going to be alternate glutes. So I'm going to get you to start with your feet just about hip width apart, knees soft, hands on your butt as you did before, and you're just going to start swaying left and right. As you sway onto the left, try and get your left glutes to fire. As you sway onto the right, try and get your right glutes to fire. So left glute, right glute, left glute, right glute. And as your left glute fires here, try and make sure the right one's relaxed. As the right one fires, make sure the left one's relaxed. So we really are just alternating. It's a bit like snowboarding or skiing, but we're just getting the glutes really working there. Okay, and that's great, but this is not how we walk. So then we're going to go into a step forward. So if you put your left foot in front of the right, as though you're going to take a small step. And then we're just focusing on the left glute here. The right hand is just there to make sure that the right glute stays relaxed. So as you rock onto your left foot, I want you to tense that left glute, and then come back and relax. So it's glute on, glute off, glute on, glute off, wax on, wax off. So we're going for that with the glutes forwards and back, glute on. So as it's loaded, and then as you offload the leg, the glute comes off. So this is the point. Okay, now let's try the right leg. So here we go, right leg's in front, dog's also in front, glute on, glute off, glute on, glute off, glute on, glute off. And then this is the way that I just want you to start thinking about this when you walk, is that as you walk, it's left glute, right glute, left glute, right glute, left glute, right glute. And so that becomes much more your default setting. And the other thing to think about is as you start walking, is not just thinking about pulling the glutes at the back, but you can also start thinking about opening the hips at the front. So if you come walking, I've heard it described as walking up and out of your hips. So if you try and walk up and out of your hip as you go there, you are also more likely to get that glute firing, and then you get that really open hip at the front, which can help with the sort of impingement-y symptoms that you can get when you sit too long and the front gets a little tight and pinchy. So that is how you release and then activate the hip. So we've released the back of the joint capsule, and then we've activated the posterior fibres of gluteus medius. There you go.